we've had a breast cancer center for 31 years. It's been fully accredited every 3 years by the American College of Surgeons. And we've been told with some of our commendations that we have a program which is almost on an academic level, which is important. We see all types of cancers and access anywhere from 475 to 500 cases a year in all systems. But we've always been very strong with respect to breast cancer. We have women, we average over 100 and as high as 150 new diagnoses per year, of which we take care of greater than 95% here. So it only made sense that we should have a breast health center with state-of-the-art technology so that we could take these patients and have them get their treatment in Plymouth, because we found that the community-based cancer center was successful because people wanted to stay here. So why not give them state-of-the-art breast health so they could stay at the Jordan Hospital and in the community with their family support?
Well, the Navigator is actually very new in cancer care. It's only been around for the last couple of years, and so we're very grateful that we've been given the opportunity to recruit for this position. And we think of it as the linchpin, the person that's going to keep the patient at touch with all points in their potential treatment plan. So she's going to really ensure that the patient has all the appropriate appointments that they need to have, that they follow through, they have their exams, and that the patient can actually contact the Navigator with any concerns or issues that she has. So really alleviating a lot of the stress and anxiety as women go through cancer care and treatment about when their next doctor's appointment is, what's a test result going to be, how do I prepare for this exam or test, when will I expect my results to get back. You know, really that security net, so to speak, that really helps a woman get through treatment. Karen, anything else you want to add?
No, basically, patients will come in, have their imaging done, and after they're diagnosed with a problem is when our breast navigator will step in and take over and follow her through the system. So there won't be any holes in the system at all. This is our breast ultrasound room, again unfinished. So patients can actually move through the system very quickly. If we call them back for any reason at all and they need to have a breast ultrasound, we can move them right through the system and hopefully get them in while they're here to get everything done at the same time.
One of the goals that we're trying to actually have with this program is developing an interdisciplinary breast care program for women, so that when a woman actually has a positive diagnostic finding, the entire team will come together, the surgeon, the medical oncologist, a radiation oncologist, social service team, dietitian, the Navigator nurse, of course, to actually look at the woman's case and discuss what is the best treatment plan for the patient. And hopefully during that one day when we run this interdisciplinary clinic, the woman will actually leave with a potential treatment plan for her to make up her mind about what her options may be. So most of the truly great breast centers are actually providing care in that manner, and so we're very fortunate that we're actually going to start that program in November.
One of the things we do is we have all the imaging studies. We have the pathologist there. We can review the actual pathology. So it's a complete assessment, something that we had this interdisciplinary conference before, but we had to all come from different sites to join in a spot to make it all happen. So the pathology component is a critical component, looking at the imaging to get the complete picture, plus you understand we've already met the patient, if we understand if some of their social issues, some of their psychological problems, what problems they have in the family, and that's why we can address these other things with support services right here. And I think that's important.
The woman has to have additional treatment beyond surgery. The treatment plan would probably be either chemotherapy and or radiation together, and that would happen in the cancer center. 15 yards down the hall, the cancer center has medical oncology with 2 infusion treatment chemotherapy stations. Actually would be providing treatment there, and radiation oncology is right next door. So very nicely contained in a very small area.
The critical thing is this. If you're a woman in Plymouth or in the environs and you come to our hospital, what we're trying to tell you is that you're going to get state-of-the-art care, that the outcomes will be measured so that you can understand that if you get your care here, it should be equivalent to care in other areas of this state and other areas of the country. And that's to me, that's the value. This is for women and the occasional man who has a breast problem that can stay in the community and get their treatment and feel like their treatment is not only competent, but it's at the highest level. Our public open house will be the 4th from 11 to 2, and we hope people in Plymouth do come to see it, and in any area around Plymouth. And the mammography will be up and running October the 5th. So we'll be doing everything that we've done, and there'll be, all systems will be tested, within a few days, but we should be open and functioning.